Okay, we are talking about the different routes. Systemic route include oral, sublingual, and rectal. The second one is parenteral. That is going to be you have to add the blood, the drugs directly into your blood or your muscles. Intravenous, intramuscular, subcutaneous, intraarterial, intraarticular, intrathecal, and intradermal are some of the routes of the injections. So we have to discuss all of them one by one. The first one is the oral route. The oral route means that you have to take the medicine through your oral cavity. You can take the different medicines, like you can take the powders, you can take the tablets, you can take the syrups, capsule, and these all things. Advantages of the oral route are that it's the safest one, convenient for everyone, painless, economical. Everyone can take the medicine easily. They are cheap one. Self-administration, you can take it by yourself. But the disadvantages are its onset is too slow. First pass effect, that it has to pass from the first pass effect is the thing that the medicine is going to pass from your liver and it is going to get metabolized in the liver. And you can't get the full amount of the drug. For example, if you are going to take a drug, you can't get the 100%. So that's why it's a disadvantage. Drug destroyed by the digestive juices. Yes, HCl, the main one that is going to destroy the drugs. The last one cannot given to the unconscious and unoperative patient and cooperative. So the person who is unconscious, for example, anyone who is doing vomiting, you can't give the medicine to that person. You can see the slide. The next one slide is about dosage form, the oral dosage form. Capsules, powders, tablets, pencils, syrup, emulsion, suspension, and the elixir are the common dosage form. Do you know about the difference between the capsule and pencils? Everyone from you know about the difference? The pencils are capsules, but they are going to be like sustained release capsule. We can say that these are sustained released. They are going to release the medicines for a longer period of time. That is the main difference between them. The next one route is sublingual route. The sublingual route means you are going to give the medicine again by the mouth or the oral cavity, but just the thing is you have to give it sublingually under the tongue. And the buccal route, you have to put the medicine in your buccal cavity. The drug is going to be absorbed from the membrane. Please mute yourself.
नहीं बताना
Please mute yourself. Okay, we are talking about the sublingual route. The GTN and buprenorphine is the best example for sublingual tablet. So what is GTN? Do you know about the nitroglycerin? The main thing that we are going to use for the heart problems, for the BP, blood pressure. Is it clear? Nitroglycerin, also known as glyceryl trinitrate, that is the again the main thing that is the GTN, glyceryl trinitrate, and it is used for the high blood pressure or the heart failure. And buprenorphine is an opioid that is used for the pain relief. Is it? Okay, the next thing sorry, screen, stop sharing. Let me continue it again. Okay. The next one thing is advantages and disadvantages of sublingual tablets. The first one is quick onset of action. If you're going to take the medicine sublingually, for example, mostly in hypertensive patient, we use the sublingual tablet nitroglycerin. Second advantage is it bypass first pass effect. Again, if you're going to take the medicine orally, it will go into your stomach and then it will cause different problems, not the problems, it will be destroyed from the gastric juice. Can be spit it out if the side effect occur. You can even spit it out. If you think that there is a problem, then you can easily spit it out. Disadvantage is distasteful drug cannot be given. Drugs of high molecular weight are not well absorbed. If the drug is distasteful, then you can't use it. Even the nitroglycerin is distasteful, but it is not too much distasteful. Drugs of high molecular weight are not well absorbed. The second one disadvantage. Do you know about the things that the drug molecules can easily absorb with the low molecular weight from the lipid layer, but with the high molecular weight, they can't absorb. The next one route is rectal route. Drugs are administered rectally as a suppository. In this form, a drug is mixed with a waxy substance that dissolves or liquefies after inserted into the rectum. So most drugs, we can give the drugs to the rectal route. That is the best one for the unconscious patient. The best example are the diazepam, indomethacin, paraldehyde, and ergotamine. Advantage of the rectal route is used in patients with nausea and the vomiting. It bypass pass effect again, useful if drug is gastric irritant. If the drug is going to cause the gastric irritation, then you can also use the rectal route. Disadvantages are chances of rectal inflammation, absorption, unreliable, inconvenient, and embarrassing to the patient. Again, the urethral route is same like vaginal route. Again, given to the patient who are unconscious or to the children, or the patient have the nausea or vomiting. The next one is may cause irritation and absorption may be variable. Parenteral route. The parenteral route are the different routes. You can give it, let me show you this one diagram. There are different parenteral routes. Please mute yourself. The first one layer is the epidermis, then the dermis, then the subcutaneous tissue, and the last one is muscle with the veins. So you can give the intravenously or intramuscularly or subcutaneously the medicines. If you are going to give IV injection, then you have to put them in the vein here. If you are going to put the injection subcutaneously, then you have to give it here under your skin. And the last one is the muscle, in the muscle, so you have to put it here, intramuscular. Now we have to study about the advantages and disadvantages. Quick onset. We all know about the onset of action of the parenteral route, that the onset is quick. It can bypass the first pass effect. Again, useful if the patient is unconscious. You can't give the medication through the oral route, so you can use the parenteral route. Large volume fluid. Yes, you can give a large volume of fluids through the parenteral route by the IV, in the form of the IV fluid, not all by all the parenteral route, just for the intravenous. Gastric irritating drug given amount of drug control. You can even control the amount of drug, that how much you want to give to the patient. If the drug is gastric irritant, then you can use it intravenously again. The disadvantages are that it is painful, aseptic condition needed. Aseptic condition, why aseptic condition are needed? Because if you are not going to give the aseptic condition, then maybe there is bacterial infection, or maybe Any other thing can enter into your body, that is a great risk. Risk of thrombophlebitis. Introduction of air to a particular embolism. Thrombophlebitis, what is that one? Thrombophlebitis is inflammatory process that cause a blood clot to form and block one or more veins. And embolism is the logging of the embolus, blocking again the blocking of the vein due to the any material. If it is maybe air, it is maybe a blood clot, it may be a fat. The next thing we have to study is subcutaneous. Advantages and disadvantages again: smooth absorption for longer period of time. Depot injection can be given. Smooth absorption is easy, like you are not going to put them in the veins. Now you have to put them under the skin. You have to just take your skin and put the injection, like insulin is given subcutaneously. Disadvantage is that you can't put a lot volume like in the intravenous. Please mute yourself. The next thing, irritant drugs, necrosis and slogging. Irritant drugs can cause irritation. Necrosis can occur, slogging can occur. Do you know about the necrosis and the slogging? Necrosis is the death of the body tissue. It occurs when too little blood flow to the tissue. Slogging is the next terminology. Skin slogging, like shedding of the skin or the dead cells. The next thing that we have to study is intramuscular layer. Intramuscular injection, onset of action is very fast, and disadvantage is again the same. It is painful. All the injections are painful. They are risky. Aseptic condition are needed. And main thing, skills are needed. I will give the answer of every question at the last of the lecture. Don't worry about that one. The next one is intrathecal. Intrathecal route is mostly used before the delivery, or when you want a patient, like the drugs that can cross the CNS, blood-brain barrier, or cerebrospinal fluid. If you want to put the drug into cerebrospinal fluid, you have to give them intrathecally. Drugs act directly on the meninges and CNS, but pass the blood-brain barrier and blood cerebrospinal fluid barrier. Disadvantage, strict aseptic precaution are needed. Painful procedure because you are going to put the injection in your backbone. And the last one is the expertise required. Expert one can give the injection. Again, the same. Inhalation route. Inhalation means you are going to inhale the drug into your lungs. The first thing is the first absorption route. Second one, onset is quick and you can self-administer the drug into your lungs. Disadvantage is it causes irritation. Irritation of your muscles, like not the muscles, your tract, respiratory tract. It can cause irritation at any point. You can inhale the drug through the atomizer or nebulizer. The next one route is the topical route. You have to put the drug on your skin, not inside your body, not systemically. The first one, conjunctival route. Second, vaginal and urethral. Next one, injections or rubbing of the drug on your skin, like you are going to massage with the oil, that is injection. Transdermal patches. Now we have to discuss about the transdermal route. You are going to take the drug through the transdermal. Transdermal means the dermis is the first layer of the skin. So what you have to do, you have to put the patch on the skin from which the drug is going to be absorbed slowly. There are some examples. The first one is the nitroglycerin. Nitroglycerin patches are available in the market and you are going to put them on the chest or the upper arm, and it is used for the angina. Clonidine, shaven areas of the upper arm, and it is used for the hypertension. Estradiol on the trunk, fentanyl trunk, chronic, used for the chronic pain. Scopolamine is used behind the ear and it is used for the motion sickness. When you are going to move anywhere, you can use these patches, like for the longer tours. Testosterone sputum, testosterone deficiency. It's a hormone. Estradiol and testosterone are the hormones. Thank you so much. Now, if you have any question, you can ask.